To determine the appropriate off-the-shelf Rome brace size, using a tape measure, take 3 circumference measurements. 1 at the knee center, then at the thigh and calf, 6 inches above and below the center of the patella. Using the Rome off-the-shelf size guide, choose the size that best fits the patient based on the measurements. If the patient's measurements and anatomy present findings better suited for a custom brace, use the DonJoy CCMI Mark III custom measuring device to measure for a custom Rome. If there is a need to telescope the thigh or calf cuffs, perform those steps prior to fitting the brace. The instructions for telescoping thigh and calf cuffs will be demonstrated later in this video, as it is not applicable to all fittings and must be performed by a trained fitter. If this is the first time fitting the patient with the Rome brace, follow these pre-application steps. First, open the brace by releasing the buckles on the thigh and calf cuffs. Then unclip each magnetic latch by sliding the latch towards its buckle until it releases. With the patient sitting on the edge of a chair, flex their leg to 45 degrees. Position the center of the hinge slightly above the center line of the patella and slightly in front of the midline of the leg on the affected compartment. Now reconnect the magnetic latches. Then close the buckles on the thigh and calf cuffs. Next, ensure the BOA dials are in the fully extended position by rotating each dial counterclockwise while pulling on its strap. Then tighten the thigh and calf circumferential straps to a snug fit. If necessary, remove the hook and loop strap ends and trim excess strap material with scissors. Then replace the hook and loop strap ends at the end of each strap. Now straighten the patient's leg and position the center of the condyle harness on the unaffected side of the knee joint at the joint line on the medial or lateral aspect of the leg. While maintaining the position of the condyle harness, adjust the posterior straps from the alligator tab of the condyle harness. Pull the strap tight. Trim excess material and reattach to the alligator tab. Then repeat the process for the calf strap. While maintaining the position of the condyle harness, separate the BOA thigh strap from the alligator tab of the condyle harness. Pull it tight. Trim if needed. Then reattach to the alligator tab. Then repeat the process for the calf BOA strap. For tensioning, move the leg back into a flexed 45-degree position. Then rotate the BOA dials clockwise to tighten as necessary. Note the indicated location on the printed graduated scale. Additional fitting instructions for telescoping the thigh or calf cuffs and inserting flexion or extension stops. Prior to fitting the brace, follow these steps to adjust the telescoping cuffs. This should be done only by a trained fitter. Remove the thigh and calf cuff lining pads by pulling the pads away from the cuffs. Using a 5/16 flathead screwdriver, rotate the slotted cap head counterclockwise to release. Now repeat for the second cap and place the caps to the side. Lift the bar up away from the cuff and reposition to the desired location. Insert the slotted cap through the cutout on the upright bar and tighten into the threaded insert until 2 clicks are reached, indicating full engagement. Now repeat for the second screw. Next, secure the lining pad by placing it over the inside surface of the cuff. Ensure full coverage and lightly press into place over the Velcro engagement. Follow these steps to install the hinge stop. This should only be done by a trained fitter. First, detach the condyle pad. Then remove the hinge stop screw using a precision Phillips head screwdriver. Now release the stop from the hinge. Then insert the desired extension and/or flexion stops into the hinge in their respective locations. Insert and tighten the supplied screw into the hinge inner plate, securing the stop. Now reattach the condyle pad.